Okay, today we're going to talk about melasma as I'm sitting in my car waiting for my husband to get the groceries. For those of you that don't know me, I'm Dr. Joyce. I am a dermatologist and I help treat skin issues like melasma. So this is melasma. Melasma is a condition of hyperpigmentation, meaning you get these kind of mottled, speckled, brownish patches, most commonly on the cheek area. You can get them on the forehead, your glabella area. You can get them around the nose, around the mouth is a common area, and the chin as well. We know that melasma is caused by a complex interplay of a lot of different factors, like genetics, sun exposure, hormones. For example, a lot of women experience this around pregnancy. So we even call it like the mask of pregnancy. I know, so many great things that come with pregnancy, right? Some women even start to see this when they use OCPs or oral contraceptive pills because that is a similar hormone. Definitely there is a genetic component to it. A lot of people who get it tend to see it in their parents or their siblings. And for sure, we do know that certain environmental exposures makes it worse, like exposure to the sun. And there's newer research coming out that even exposure to visible light, like blue light from cell phone screens, laptops, tablets, that kind of thing, that can actually trigger this inflammation to get worse. Here's another photo of melasma, this one kind of more speckled on the forehead area. So let's talk about treatments. When I talk to patients about melasma, I kind of break it down into protection and prevention, and then there's the actual treatment, and then there's procedures. So if we first want to talk about prevention, number one key thing to remember is sun protection. So I'm talking protection from UVA and UVB through the use of broad spectrum sunscreen, SPF 30 and above. If you're going to be out all day, I strongly suggest using SPF 50 and above because you're probably not even using enough to get the full benefit. And for individuals with melasma, I do strongly suggest using tinted sunscreen, meaning it contains iron oxide. So that will help to block visible light. Topicals can be very helpful for this condition as well. I typically use a blend of hydroquinone, which is a bleaching cream, along with a steroid to calm down inflammation, as well as a tretinoin, like a retinoid or something to help with cell turnover. You can also use vitamin C to help with this. And procedures that can be helpful are chemical peels or laser with the right person who knows what settings to use. Otherwise, it can get worse.